We now know, based on the last 15 years of neuroscience, that addiction is a pediatric disease.
The adolescent brain is still developing. There can be permanent effects of drinking while the brain is still developing.
They do not understand that their brain is still in the development stage, and how alcohol and marijuana and illicit drug use can affect their brain.
So they're going to their primary care provider, their mother's there with them. They're not going to say, yeah, I have a drinking problem, but it's also not being asked.
College students are more likely to engage in binge drinking.
Those who begin using at age 14 or under are at 5 times the risk of having addiction and related serious mental illnesses later in life.
A significantly higher risk of developing an alcohol problem.
If parents engage in binge drinking, their children are twice as likely to engage in binge drinking and to develop alcohol dependence at some point in their life.
This is a family issue.
They're not using substances for just to feel good anymore. It's more they're using substances to cope.
You know, is it to fit in with your peers? Is it because you need to escape something that's going on at home?
Underage drinking before age 18, age 21, that's a much more common phenomenon, and I think it's viewed by many people as a very harmless kind of activity.
Students who went to college were the least likely to be asked about their substance use.
But I think the government has placed more emphasis on treatment, incarceration, interdiction, and even on foreign adventures, you know.
There's no silver bullet to reducing underage or college drinking. It really requires a comprehensive effort.
In order to change something, you need to have numbers.
But if they see the data and we bring awareness to the age groups of people who are being affected, especially here in this Atlanta metropolitan area, then they'll be able to see, yes, we do have a problem.
One works with multiple departments of city government, the health department, the school department, the police department, the alcohol beverage control, and also with private citizens.
Having clinics where they can come in and be comfortable and have somebody to talk to, not judge them.
The more you use motivational interviewing, the more likely you are to have a non-threatening, non-judgmental conversation with the student about their risk.
I think I would have mental health professionals, you know, anywhere that the adolescents are, in the schools, in primary care.
Developing comfort level with motivational interviewing skills. Tell me, what do you like about smoking marijuana? And then what do you like less about smoking marijuana? And the student will say, wow, she wants to know what I like about it.
Family conversations. When you're trying to motivate adults, talk about why it's helping their kids and their community. If as adults they're healthier.
So it's really a matter of working with families.
The best hope for turning the tide is in prevention. It's preventing kids from starting. We need to get the message out, and we need to get it to children when they're younger.